So today I'd like to talk about the necessity of carrying good CPR equipment for the tactical medical professional, for the layperson, for the prepper, for the soccer mom, but even more importantly, for the highly skilled medical people that are not taking anything with them to use their skill set to save their loved ones or their neighbors. Something I see a lot of on the market are these CPR pocket resuscitators. And while this is better than putting one mouth onto another mouth to perform rescue breathing in CPR, it's not as good as it could get in terms of delivering adequate ventilation in a stressful scenario, even for a medical professional or a tactical medical professional. So this is better than providing rescue breathing with just your mouth alone, because this is designed to seal over the nose and over the mouth, a two-part ventilation system through the nose and through the mouth, which is much better than squeezing the nose, trying to deliver rescue breaths. When you bend over and you deliver rescue breaths or emergency breathing in a CPR scenario, your face is no longer able to process information in a two-part system, watching their chest rise and chest fall, or looking for a flail chest or a tension pneumothorax for the advanced practitioner. So bending over, delivering breaths here is good. It's better than using your mouth, but it's not as good as it can get. I'm really going to focus today on the Pocket BVM, bag valve mask. I'm very grateful to the people over at Persis Medical for sending this out for me to test and to review. This is by far the most superior product I have ever seen on the market. I think everyone should carry this, from the tactical medical professional to the ICU nurse that's not carrying gear with them now, to the soccer mom. This is a bag valve mask that is compressed into a highly sealed unit. You twist it open, very much like a Tupperware dish, and you remove the bag and the mask and the valve from there. And very much like the Pocket CPR mask, this has a mask that will complete a seal around the nose and the mouth, but it's designed to fit an ET tube or an intubation tube in a clinical environment. So contained in the BVM is the bag, the mask, the valve, and it also comes with O2 tubing for the medical professional. Lay people that use this, you just keep that in your kit. You don't necessarily need this. This is better. You just kind of tug right here. You don't want to grab it by the valve. You grab it just behind the valve, and then you're going to grab it by the reserve oxygen bag and pull outward. You apply this to this little connector, to the flange. This is made of like a silicone composite, and it's going to deliver accurate ventilations. Instead of bending over to breathe, you can now get a good seal around the mouth, a good seal around the nose. You can do a head tilt chin lift, just like you would in your normal CPR training, and you can now assess information as you're delivering ventilations and your partner is delivering chest compressions. This is by far a superior setup to just the regular CPR pocket resuscitator mask. Why? Because the volume of this bag is specifically designed to deliver a particular volume of ventilation to your patient. In the event that you have access to oxygen, you have oxygen tubing that can connect here, and your reserve bag would fill up, so then you're aware of how much volume of oxygen you're delivering. This is supposed to be single patient use. I would stick to that. For the backcountry practitioner, you can practice with this and then fold it back up and it goes back into its carry case. So then you're practicing your motor skills and the bag is still good to go. You can potentially disinfect this. I know that that's a clinical no-no for people in the field. If this thing isn't covered in blood, if it's not covered in anything goopy, I would disinfect it and keep it for myself. You have a chance to win this through SUL Tactical. Go to our webpage, go to our Instagram channel and our Facebook channel. Look for chances to win these in the weeks ahead.